Good afternoon. My affiliation with the IPM project began at Sheppard Pratt in 2010, and as a result of becoming a partner in the project, I developed a deeper understanding of how pesticides can truly affect the health and safety of our patients and staff. Knowledge is power. I learned how important it is for facilities to ensure our contracted vendors are implementing a prioritized pest and land care IPM program, whereby least toxic pesticides are only used as a last resort inside a building and on the facility grounds, only after all non-toxic interventions have been exhausted. EVS directors are busy people, and we understandably rely on our expert vendors to just do the IPM job we have hired them for. But in truth, it just doesn't always work out that way. The vendors work for us, and it's critical to ensure that they're in fact first doing no harm when it comes to their pest and land management work. As a result of the IPM project's pro bono reviews for participating project facilities of their facilities pest and land management care, we have found that all too often vendors resort to a see 'em spray 'em approach, or even a spray 'em before you see 'em approach. That is clearly not IPM and does not protect patients, residents, or staff from unnecessary pesticide exposure. You will hear more about this today from public health and IPM experts, another EVS director, and from the perspective of pest management companies that are committed to first do no harm. We decline are in control when it comes to ensuring implementation of our facilities pest and land care management contracts. Always remember, we hire and manage the vendor, not the other way around. It's important for the facility to have a clear IPM contract and facility policy based on prioritizing non-chemical pest prevention and only allowing the use of least toxic pesticides chosen from an agreed upon list as a last resort. If your facility IPM policy is not followed, it could jeopardize the health of patient, staff, visitors. The EVS department will benefit from making sure that your vendors provide all specific locations of pest pressures, along with recommendations for housekeeping and all maintenance actions needed to address and prevent further pest problems, and are fully documented and reported to your department. Our project has found that this is not always the case. Especially critical as an IPM program is addressing housekeeping and maintenance issues. The technicians need to provide you with detailed notes on their observations in regard to needed non-chemical preventive measures and interventions, along with ensuring their service tickets and logbook entries are fully filled out. Sending an additional email to the EVS director / maintenance housekeeping actions needed is a priority for me since our time is limited for reviewing service tickets. IPM is a team approach. Set up monthly, quarterly Q&A meetings with the pest and land care vendors and other facility departments to fully review noted issues and get / give feedback. It's great to get your safety officer, product standards committee members, and green teams involved in these meetings whenever possible. And here's a few questions I'd like to keep in mind when meeting with a potential vendor or negotiating contract renewal. Number one, what's their definition of IPM? Number two, provide evidence of compliance with other facilities' IPM policies and their willingness to adhere to a prioritized IPM systems and even pesticide-free grounds. Number three, provide a listing of least toxic alternative pesticides their company uses that our project is happy to review. Number four, send you a current list of clients that they service that have established prioritized IPM policies. Also, these days there is COVID-related issues used of disinfectants, as you will hear about today from public health experts. Pesticide registered disinfectants are being used and facilities can actually cause or exacerbate COVID-related respiratory issues as well as weakened immune system. The IPM project developed a website to help facilities decipher safer versus increased risk disinfectants on PA's NL list of disinfectants. Please check it out. In closing, developing a strong prioritized IPM system is critical for controlling infections and ensuring the health and safety of visitors, patients, and staff. I want to thank everyone today for dialing into this most important webinar. Thank you for your time.
Thanks so much for watching our expert on IPM. I'm Sean Lynch, the director of the IPM and Healthcare Facilities Project at the Maryland Pesticide Education Network. We hope this has inspired you to consider new steps you can take to make your facility safer for your patients and staff. Please reach out to me at email at sean@mdpestnet.org if you have any questions regarding implementing IPM at your facility. To learn more, please visit the project at mdpestnet.org. Choose projects and then the IPM and Healthcare Facilities Project.